keep him with the blue lips this week.
Do you want me to change them?
No, I don't care. It's about depression.
That's not really.
You're in character. You're in theme.
I think it would be more in theme if it was like black.
No.
Blue.
Depression is blue. Sad is blue.
It's true, but this is like a
Also cyanosis. You should wear a pulse oximeter.
Welcome to the Bunk Room Chats podcast. I'm Elena, also known as Betty.
Tim.
Still Tim.
Still Tim.
And today we are talking about, this is our second episode on depression.
Today we're talking more about the managing of depression and the avenues that you are available. I mentioned last week that you don't have to take meds if that's not your thing.
Yeah.
First and foremost, we'll start by saying that you need, if this is something that you're seriously wanting to follow up on, you need to start with either a mental health care provider or your primary care physician.
Mm-hmm.
The primary care physician, if you see one regularly, can administer enough to see that you fall into a certain criteria to refer you to further help if need be.
Yeah. But your ongoing psychiatric care is not going to be through your general physician.
It shouldn't be, at least.
It should not, yeah. They're just not equipped to do that. Most do not have the
they're
expertise.
They're general care practitioners. Yeah. They're not psychiatrists, which is what you need, which is what I needed to remember when we get to medicine. So start, if this is something, if you watched last week's episode and I don't know, something hit home or you want to follow up on it, if you know us, of course, you can always reach out to us and we can put you in contact with some great people. But it's always the safest bet to start with your own personal primary care physician if you have one, because they need to be on board whether or not they're going to be the one handling your ongoing care for the depression or whatever. They need to be just as much a part of it, because if they prescribe something for hypertension down the road that might not mix well, of course they need to be. So let's talk a little bit about, after you have your depression diagnosis, what do we do from here? So let's say you already have a depression diagnosis. You've already gone to the doctor. You've already done the things you already know. Hey, I have it. I deal with it. It doesn't bother me. It doesn't pop up. But I might want to investigate a little further. Then what do we do now? Or you do see that you're hitting some of these red flags that we were talking about, like, appetite disruption, eating disorders even, intense sadness. Like you can't put a gauge on it. You wouldn't know. I mean, it's a heavy feeling if you have the intense sadness part of it. If you're easily irritable and don't know why. Low sex drive, I think, and some of the other ones that we discussed always can be watched again in the episode previous. But something hit home and you want to learn more or do more. I can tell you what I do. Elena or Betty can tell you what she does, and you'll see that it's two completely different
Avenues.
things that we do to manage our depression and to try and manage it appropriately. Because we're all like snowflakes. You know, no two snowflakes are ever alike.
Yes.
That's a good metaphor.
It is. It's very true.
Snowflocky. We're all like little snowflakes. No. But yeah, we are all unique, and we need unique care when it comes to our brains.
Yeah.
Men are usually cut from the same cloth. If it's cardiovascular or something like that, there's the rule. There's enough that we can have standing orders in the field to practice paramedicine, for certain things like heart problems, lung problems, etc. Broken bones. But what you can't do standing orders for, or I don't think I've ever seen one, is for anything neurological. Well, you can do like nerve blockers, ketamines, and stuff like that. But we're talking about, oh, actually, ketamine is a treatment for depression. But anyway, that's besides the point. R.I.P. Matthew Perry.
Oh no!
Well,
Forgot about that. I forgot that was his drug.
So you can't go messing around in somebody's brain without being a qualified professional, I would say. So what I wanted, and it doesn't even have to be about medicine. I always think to talk about it whenever I'm discussing medication with somebody. But probably your first step, I would say, after either receiving a depression diagnosis or thinking enough that you go get looked at and want to pursue further care, maybe some therapy or something, you should start with a psychiatrist. That's what I always tell anybody that asks me for my opinion on things. And it's what I did, because you're talking about starting prescriptions. Now, if you're going the medication route, that's why I brought it up on medications. You're talking about prescribing some medicines that are going to go right for your brain.
Yeah.
This isn't like blood pressure pills or anything. This is going into the nerve center.
Yeah.
And so this probably, I think, shouldn't be prescribed just from your primary care physician. I think at least the first time you should see a licensed psychiatrist. That the difference being a psychiatrist can prescribe medicine, a psychologist cannot, or a therapist cannot.
Yeah. Which is super unfortunate, because I think that therapists understand you so much more. You can, like, I don't know, like, how your relationship is with your psychiatrist, but if you have in the past, but
well, after you see the psychiatrist, I haven't, after I got my initial prescriptions from a psychiatrist, like I don't feel the need that you might need to go back to do some maintenance, like, hey, this isn't working anymore, like, is there anything else? But as far as prescription refills and stuff, that can then be handled by your general care physician.
Yeah.
Like, you don't have to go see this motherfucker on a weekly basis now.
Yeah.
But the initial prescribing should probably be done by a specialist in the area.
Yeah. No, but for no other reason than general physicians, they just have such a, their
jack of all trades.
Their scope of knowledge of
Practice.
medications is so much more limited than psychiatrists. But I think what's unfortunate is that therapists, you build this rapport and you explain, they understand everything going on with you. And then with a psychiatrist, you see them for an hour and a half intake. They give you medication, then you don't see them again for months. So, like,
but they went to med school, though. Like, they are doctors.
I know that. I'm just saying it's sometimes I wish that the therapist could just, because they understand you so much more.
I'm sure the psychiatrist can ask for opinions on it. as long as the HIPAA violation is, you'd have to
You have to, fill all
agree.
those forms out.
You should be sharing care with whoever is dealing with you. That's what I was getting at with the general care physician needs to be your primary care needs to be on board with this as well, because they're gonna take care of you for other things that might affect what you're on.
Yeah.
And so, yeah, I recommend seeing a psychiatrist for the initial prescribing, and then you can get all of the refills and stuff through your primary.
Yeah.
That's the medication route. This doesn't work for everybody, and some people don't want to take medicines. Some people don't feel right on them because they do fuck with you.
They really do mess with you. And that's another thing too. A lot of people, I know when I first started on meds, for depression, I was afraid to say like, hey, I don't like how this makes me feel. Cause it's like, oh, well, they said that this is what's right for you. So this has to be what's right for you. But that's not the case. Like, it affects different people in different ways. So never be afraid to the potential
side
gain.
effect. The juice isn't worth the squeeze.
The squeeze, yeah. It's not.
What a stupid saying.
It is very stupid. To tell your psychiatrist, hey, this isn't working for me. I'd like to try something else. And kind of go from there, because there's no obligation to say. A lot of times they'll ask you to give it a certain amount of time, but even then you don't have to. Even then you can say, hey, it's just too much. I've done that a few times where I started a med and it was so bad. I was like, I'm done. I'm not going to wait.
A lot of times it takes a good while to get things dialed in correctly too. Like, it's not the easiest route to take. It's definitely the laziest comparatively to all the other options and avenues available, like going out for some stimulation and exercise.
Yeah, but it's a combination.
I'll take a pill every day so I don't have to go jogging.
Yeah. Nowadays.
No, but I know I fell into it like you did. Like, they know what's best. I should probably be on these.
Yeah.
But yeah, I didn't feel right initially, and it was a matter of fine tweaking, which was helped by going to see a psychiatrist about it, and then just getting everything dialed in correctly for me. I'll tell you, I enjoyed talking with the Preers because I'm kind of almost jealous. He got off of those medicines. And, I've got pill bottles fucking everywhere for other things and mental health things, and who can keep track of all the shit? Yeah. But it's got to be liberating to be able to. He looks like he's doing really well, right? And I mean, they're doing the running. They're going out for physical activity, stimulation, getting back into just the outdoor life. That helps them though. And
but I think people don't do that enough. I think that people, like you said, there's absolutely nothing wrong with medication, and in so many ways it makes a huge difference. But I think people use it as like a cure-all type of thing, where you don't have to go outside. Just going outside can make a difference, especially in the winter. Just going outside, go for a walk, meet a friend, even if you're by yourself, do something like that. And I will swear by physical activity every single day. Like, if I didn't work out, I would be tremendously depressed. I need that physical activity. And I think the majority of Americans especially spend way too much time inside and way too much time not physically active.
Yeah, and that was a big problem with me. I hate it. I hate jogging. But I'll tell you, when I got off my ass and started going out and doing an hour of cardio every day, now with the weather, I haven't been, and I can't jog like this, so I haven't been going out. But I can tell a difference. Yeah. I can. The dopamine's firing. It's 100% different. Yep. Call it a runner's high, call it whatever. It jumpstarts the day in a way that I wasn't able to accomplish before. And that's the other thing about meds is don't don't think taking a pill every day is just going to solve everything.
Yeah. Yeah, it's
Unfortunately,
really
that's not the case.
You still have to work on things, even if you do. Even if you're on meds, it still should be go outside.
A lot of it is
some physical activity,
what's
be around
called
people.
medicated assistive therapy.
Mm-hmm.
So, what that is you're on these medicines, but you have to work essentially they work
Yeah.
alongside
What you're already doing.
another program, like
Yeah.
alongside therapy, alongside physical activity. What else we got? Side brain stimulation outside of just going out for uh, like a walk or whatever and stimulating your body, but
Yeah.
brain stimulation like doing crossword puzzles or
Do something that isn't just scrolling, doom scrolling.
mindlessly scrolling on
That's just
as I
so
scroll down my
mind-numbing.
iPad here.
Yeah, but it's so mind-numbing. I think that's got to be part of why so many people are depressed. You spend so much time just scrolling across a screen, and
But at the same time, we can binge watch all 49 seasons of Survivor like right now. So
there's
that's pretty
49
cool.
seasons.
Yeah, they're getting ready to do the 50th. I've been watching.
Anyway, but don't do that.
No.
But at that human connection,
Mhm.
because everything is online. We don't even talk to each other anymore, and I think that is adding to depression, that feeling of isolation. So we have to kind of take the initiative and break that bubble a little bit and go out and do things and be part of the community again, and kind of force ourselves back into that space.
I know one thing my wife always said was after I got sober, or I came home from rehab and I began this sobriety journey, that I have completely 180'd and gone from always never wanting to be home, like always wanting to be out doing things or partying or whatever, or at the bar, to being a complete introvert now. Like a hermit, she calls me. Like
Because you don't want to go out and do stuff.
Like we go to the grocery store and I just can't wait to get back home and be safe. No. Well, that's one of the red flags for her, that my depression is creeping back up, and we either need to adjust medicine or do something different, because that's a red flag to her, alongside of irritableness and stuff like that I just go completely blind to. How do you not notice that you're sitting on your fucking ass all week long? Like the week is gone. Like you did nothing.
Yeah.
How do you not notice
but
that?
Your brain isn't.
When it's not typical of you.
Yeah. But I don't think you're in a headspace to see it. You're not able to,
It's just one of those things that blows my mind again, like we talked about. I don't know if I find it fascinating or
scary.
Yeah.
Yeah.
Like we're just completely oblivious. And I like to consider myself pretty sharp. So it's extra weird to me. Or a nice word. Brain stimulation. But it's extra weird to me that it hits, like I can't believe that I'm so oblivious.
Yeah.
And then so alongside of what we'll get into about therapy, and we'll get into a little bit more about physical exertion, exercise, are your things that you always hear. Whenever you say something's not right or feeling wrong to the doctor, what do they always tell you to do? Eat better, sleep better, and work out. Yeah. So that classifies in here as well. Stay active. Eat a balanced, I'll just read off of it. Eat a balanced, nutritious diet, get enough sleep, maintain consistent routine. That's actually very important.
Yeah.
If you're going, just for example, if I'm going back into an hour of cardio every day, I best be doing something every day. It might not be a home run every day, but I best be doing something consistently every day to form that habit and not allow the thoughts of I don't really want to do that
Yeah. To creep back in.
win.
But that's also why it's super important for me at least, to go to work, because that's the routine. That's if you take too much time away from that routine. Like, I'm not the kind of person, I would love to take vacation. I really need one. But I'm not the kind of person who can be off for more than like a week before I start being like, okay, I need to go back to work. I need to get back to my routine. Like, this is not this. It actually makes me depressed to be away too long, because it's like, this is not what I'm used to. I don't like this.
Wait till you need a surgery. That's something. Yeah, I was like
It was
stoked.
like that when I had Grady.
I was so stoked to have 3 months off. Just to recover and stuff, not have to worry about work. Everything's done. I could just chill out at home.
No, that would kill me.
I was more depressed. Like it just hit a point because I didn't realize also at the same time I wasn't able to bend, lift over 15 pounds or twist. So I couldn't pick up Penelope. I couldn't, I was completely helpless and handicapped here, in a place where I usually do a good bit of the grunt work, like something I couldn't even take the trash out.
Yeah.
And
so your whole sense of self and purpose and
just
that
dumb
was just
things
thrown
like that. I
upside
was completely helpless. It was awful.
Yeah.
Anyway, I was
Well,
so
that's like
happy to
how-
get back to my routine.
Yeah, that's like how I felt when I had Grady. It's like all of a sudden you can't do the things that you're used to doing, and you're. I mean, in my case, like everything that you are used to is completely upside down. That's why routine. We're creatures of habit.
Yeah.
You know.
And
What
then,
else is on that list?
Of course, the big one. Well, I'll touch on this first. Avoid alcohol, nicotine, drugs. Of course, no substance abuse, no self-medicating. Yes, alcohol helps, and I can attest to it, but it doesn't.
Yeah.
Because it's also a depressant, right? Like, so you're just treating depression with a depressant, and that doesn't make any sense.
Yeah. It brings you up just to bring you back down further.
It's a temporary solution to a problem.
Yep.
And it took me a long time to figure that out, or to listen to
I think
reason.
We're kind of programmed to want quick fixes, though. I mean, that's how all of society is. We don't want to do the work. We want, you can
instant gratification.
We're seeing that now with all the weight loss pills. It's kind of the same thing. It's like, or shots.
I don't
or
qualify, damn it, because of my stupid pancreas, because of my stupid drinking.
Really? You don't qualify because your pancreas?
Yeah, that's so when I wanted to set a goal, at least I wasn't going to get myself back out doing an hour of cardio just because I thought it might make me feel a little less depressed. I mean, it was a factor, but I am goal oriented and driven. So I was like, let's lose some weight out of this. It'll give it some purpose, and then hopefully the rest kind of falls into place the way I think it will, and it did. So I started losing some weight. So of course, old shortcut. Do I have to be doing all this running? I asked at one of my appointments, I was like, so what about these GLP-1, whatever the hell? Yeah, you don't qualify because of your pancreatitis. I should have known. That fucking pancreas, man. It's involved in so many drugs. But yeah,
at the same time,
destroyed my pancreas while I was a drunk. And that's why I can't drink anymore or I'll die. And it's going to be with me now forever. Chronic pancreatitis, and I even killed some of it off. And that's an important fucking organ, if you didn't know.
Apparently.
Well, I mean, look at people that get pancreatic gone within weeks, months.
Yeah.
I mean, it's the first line of defense for your digestive system, if I remember correctly, or for your GI tract. And everything goes through it. The way they treated it was I couldn't ingest anything
That's miserable.
other than IV painkillers, and they would let me dab my lips with a little Q-tip of water. I couldn't even have ice or whatever.
Really? Why?
Yeah, because it was so inflamed and the numbers were so bad that they needed to stop all ingestion. And then I had to slowly work back up into liquids and clear liquids. Anyway, that's straying a bit. I mean, that one, I'm always willing to talk more on that subject, but for something like this, obviously, it goes into the trifecta of a balanced diet, exercise, and don't put bad shit into your body to try and fix it. But the other one is seeking like some sort of therapy or peer support or sharing of feelings with a confidant. You don't want to go to full on fucking therapy. You don't have to.
Yeah.
You don't want to do peer support. You don't have to. You can talk to your spouse, your loved one. You can talk to your dog. You can talk to the tree out back. But some sort of a semblance where you're just openly sharing thoughts and feelings from inside your head that might be rattling around in there. And that's kind of not a very eloquent way of putting it. Maybe you can add to that. But it's important because it's also stimulation.
Yeah, just getting that stuff out and not internalizing, I think, is what's really important. And obviously, we always talk about journaling, but that's one way to do it. That's one way to get those thoughts out.
Yeah,
if you don't feel like you can talk to people, if you don't feel comfortable talking to anybody, journaling is a great way to do it. Just to feel like you're not keeping all of that really shitty stuff inside. It makes a difference.
Yes. The only other thing, understand that recovery, whether it be any kind of recovery, may be gradual. So don't get discouraged if you don't see the instant gratification, and don't give up, and set realistic goals for your time, which is that part. If you do choose to see a therapist, that's usually done in conjunction with setting some goals and what you want to get out of this and how to achieve them in a manageable time frame. So you're not out there trying to do all this by yourself, because we don't know how to do it.
Yeah. Just
walking around aimless here.
Yeah. And that's the thing too, is that I don't know of anyone who says I used to have depression. They have depression, but it's better now. So I don't think it's the kind of thing that's just going to go away. But it is the kind of thing that you can manage and keep it at bay and be able to live your life. It's not like if you take this quiz and you know, oh my God, I scored so low, my life is over. No, that's not how it works. There's things you can do to get support and to get medication if you need it, or lifestyle changes if you need it. But it's probably something that's going to be something you deal with for a long time.
Yeah. So let's dabble into therapy real quick, and then we can kind of close things, because I think those are the big three.
Yeah.
Medication assisted therapy, actual real life therapy, which we'll talk about now, and just getting out and taking care of your body. That really does have, it's just, you can't do one without the other. I don't think you can not have this as a part of your plan. Would you agree?
No, 100%.
Yeah.
And with respect to therapy, I can't speak highly enough about therapy.
Yes.
I think everybody should be in therapy, even if you feel like you are the most well-adjusted person that has ever lived. Therapy.
I say often that I think anybody with 10 or more years on this job would benefit from talking to one of those trauma clinicians that I saw.
Yeah.
Just incredible mind wizardry they did. And it's really cool to see.
And that's it. There's nothing to be ashamed of or upset about. It's just processing. It's literally just processing. And it's the same way you go to the doctor for, if something's acting up in your body, it's the same exact thing. It's just, how do you process the things going on around you?
Yep.
That's the biggest thing. And I absolutely stand by, therapy 100%. especially for people in this job.
I can't believe that I stepped away from it for so long. Like, I think I reached a point where I felt good enough that I didn't. Not that it started becoming a chore, but like I felt like I had gained what I needed.
Yeah.
Um, and maybe I should have just backed off of how
Yeah.
frequent, but yeah, we're back in it now.
I think that's the best way to do it. Like if you get to a point where you're like, you know what, I don't think I need this as much. Just maybe once a month, or if you've been going once a week, make it every other week, once a month. But I wouldn't cut it out entirely unless you absolutely have to, because you never know when something's going to come up that you have to kind of work through and process. And friends can only help with so much,
Yeah.
because
but if nothing else, it is something.
It's something.
Friends can only offer so much, but at least you're opening up a line of communication. Mm-hmm. So therapy, there's many different types for you to choose from. Like the good old-fashioned one-on-one, individual, in the room, in the chair. It's not so much laying on a couch, ass backwards.
Why is that the thing? Is that how it used to be? Like
that was psychiatry, yeah.
Because I've never laid down on a couch.
No, it's quite uncomfortable, actually. They could really do something about their chairs, especially for those of us with bulged discs. Now, and instant gratification. You don't have to go.
Telehealth.
Telehealth. You can virtually see a therapist now. So the thing that I will come off the top rope with on therapy is that you have to shop around.
Yeah.
Don't get in bed with the first one and think it's going to be a match made in heaven.
Yeah.
It might not be, and you might have to say, I need to try someone else or another route. Maybe you don't like the individual.
There have been some therapists where I've had that initial appointment, and it's like you can immediately tell.
Yeah.
You don't work. Like there's no connection there. And it is like dating. It really
and they
is.
They don't mind because they know how important it is.
Yeah.
They advocate for it too, and you're not gonna hurt their feelings because there's always somebody waiting to take your spot. They're not hurting in that aspect either.
And they know in the long run you're not going to have any real progress with them if there's no.
Yeah, you're paying for a service.
Yeah.
So you want to get your money's worth.
And it is not cheap.
It's getting better. It definitely has gotten better since I went to rehab. That's for sure.
I think coverage is getting better. Like mental health coverage.
So I guess that's psychodynamic therapy. Psychodynamic therapy gets into more of the trauma stuff, which is a whole episode in and of itself. The traumatic brain and understanding it first is very important before you can even talk about what the hell EMDR is and shit like that. So we won't get too involved on that. We'll talk about that one later, though. Group therapy is also, I advocate for this one very much because this was my first, I guess, dipping of my toe into the water at rehab. I was just, you're in group therapy right out of the gate. And I mean, of course, they start you in, you don't have to share or whatever, but whatever, I'm here, I'm going for it. So I started talking about some shit. And the next thing I know, I got everybody looking at me, nodding in agreement. And I'm like, whoa.
Yeah.
Well, you understand what I'm talking about? And it's pretty cool you almost build like some camaraderie in group therapy where you can see. Now I was there also with a bunch of other firefighters, so of course we had that bond too. But if you're AA even classifies as group therapy, like, which I still am very active in because it's part of my program. And you just go and you get something off your chest and listen to everybody else get something off of their chest, and you go home and have a good day. But yeah, I like group therapy. It's not for everybody, especially if you're very much so into the idea of anonymity and, so will ever see me walking in here and this, that, and the other. But to try if you're up for it. I liked it. It's just, there's bonds made there from people that, that get it.
Yeah.
That know what the fuck you're talking about. And it also solidifies and validates you at the same time that you're not alone and other people feel this weird shit. And, and they're a bunch of firemen too.
Yeah.
Fire women.
Fire
They're
people.
fire people.
Fire humans.
Of course, we'd be remiss to not mention couples and family therapy,
Mm-hmm.
if that is something that interests. I suggest getting started on your own if it's something that you struggle with,
Mm-hmm.
and then bringing in.
Have a foundation in
Yeah.
it first.
Start
Yeah.
on your own. Get going. Get working on you, because recovery is a slow process, like we said, but it's also a selfish process. And it's
Mhm.
okay to be selfish
Yeah.
when you're doing good work on you. So if that's something that would interest your position, it's also a really good tool to help. Like, for my instance, it's great. I've done it a couple of times with the wife. She enjoys it, and she gets kind of a look inside my world, and maybe gets a little bit better of an understanding
How your
for
brain
somebody
works.
that doesn't, a significant other that doesn't have any ties to the fire service,
Yeah.
other than she married a firefighter,
Mm-hmm.
like an idiot. And then, of course, visual therapy, you'll do something called cognitive behavioral therapy. That's a big word. In the business, we call it CBT.
In the business.
There's also DBT, dialectic behavioral therapy. Look at me go. But I'm going to read off the sheet now. CBT can help you recognize unhelpful thought patterns contributing to depression. It's a lot of things that you've probably heard of. Radical acceptance is CBT. So there's something that we've talked about on the show, significant loss. CBT is also all or nothing thinking. Buzzwords you might hear now more often than you would have back in 10 years ago.
Mm-hmm.
I don't think you'd ever have heard of all or nothing thinking, but I feel like I hear it more in not a therapeutic
Setting.
environment
Mm-hmm.
or anything. Yeah. I'll link into this one some therapy options as I see them here, and then I'll also link in what CBT is, because if you just get a basic understanding of it, it's pretty cool stuff. And you can see before going into a therapy session or starting in a route where you're going to do some therapy, you can see kind of what you're going to work on, talk about, do. It's a lot of goal setting. It's a lot of processing.
Yeah.
And that's the biggest part, is you got to, what we were talking about the call you were in, like, you got to process this thing. You can't just let it clang around up there, because next thing you know, you will come on that first anniversary and you will remember it like it was just yesterday. And that's getting into the traumatic brain a little bit, and why PTSD is what it is, and why you can remember it as if it was yesterday, even though it was fucking 12 years ago. You can still smell. It's all the sensory things. You can still see the wallpaper. You can still feel and hear the people that were in the room at the time, and remember it so vividly that as you could paint the picture, because you've never processed this traumatic event. So essentially, your brain has never been able to timestamp it and file it away like it would a good memory.
Yeah. Yep.
So that's a very basic
overview.
But anything else on? As always, if there's any questions, you can always reach out.
Yeah, we're happy to
the email.
Mm-hmm. Happy to talk to you.
Yeah, about medicine. I do medicine, medicated assisted therapy. Very important, because it's not just take a pill and you're better. I also been back in therapy. You do therapy.
Mm-hmm.
Do you still do pills? No. And then, of course, we're both advocating for exercise.
Oh yeah.
Who would have ever thought I would? But I am also down 30 pounds, so
Yay!
that
awesome.
was another thing about depression that was created. Like, I was gaining a bunch of weight, and probably from all the inactivity and poor diet. However, I've always been able to eat or drink kind of whatever I want, and because we're so active in our jobs, in our lives, metabolism is usually high. Well, it has started catching up
You've
with
hit
me.
that age.
Yeah.
You've hit the age.
Next thing I know, I was filling out some shit. So, yeah, it just accomplishing goals like that have also helped not only get my ass out there, but seeing results is what it's all about, especially for, continuing forward on a path of recovery.
A healthier path, yeah. Yep.
So yeah, therapy, medicated, and getting out there and doing some things. And like I said, we'll touch on some of the other nuances. EMDR.
Yeah. That's a whole.
Look that up.
Yeah, it's a whole episode. But yeah, and like Conrad said, if you want to reach out to us, if you have any questions about therapy, medications, not anything specific. We cannot answer specific questions about medication.
Yeah.
But we can answer questions about just, general being on meds, therapy, finding a therapist. We're always here to listen if you need that. Shoot us an email at bunkroomchatspodcast@gmail.com. You can find us on Instagram, Facebook, TikTok, YouTube, and all the links are going to be in the show notes.
That is correct. And again, not medical trained professionals here, not therapists, not liable. I mean, we should say that. And also, it should also, again, be reiterated. If there is any time that you feel like you're in crisis, the number is 988.
Yep.
And apparently that's not like 911 or anything. You can just call that just to say, hey, what's up? I wanted to see if this worked.
Really?
Yeah.
Oh, I didn't know.
But yeah, there's somebody on 24/7 for crisis hotline and suicide prevention.
Sweet.
And that is all I get. Professionals.
We will see you next week.
Oh, bye.